COVID-19 doesn't mean your body and specifically your brain will be the same.
A new study looked at MRI scans of COVID patients before and after infection. CBS 12's Danielle DeRoss has a look at the brain damage this virus can leave behind. She joins us live. Danielle?
Yeah, Jim and Liz, this is a real wake-up call, especially for the young and the healthy, because even in COVID cases that were mild, this study showed that the virus left behind brain damage.
I'm a young, healthy person. I had no prior health problems. I had no prior issues with my brain. I didn't have any issue. And then now all of this is happening, which is very frustrating.
Christina Gaetano hasn't been the same since contracting COVID-19. Her infection was mild, but her long-haul side effects are severe. The worst is the memory loss and the brain fog that leaves her struggling to speak, think, and remember routine tasks, like taking her daughter to school.
My brain is just not working.
A new study from the University of Oxford affirms to her that these long-term effects aren't all in her head. Researchers studied MRI images from patients before and after COVID-19, and in hundreds of cases, the virus left behind serious brain damage in specific areas that impact the sense of taste and smell, memory, and emotion. The images showed a loss of gray matter in the brain, even in mild COVID cases.
It's not all in our head. We're not imagining it or stressed out or having anxiety or our lives are so stressed that we're developing these issues. No, these are real physical things that are happening to our body. The question is like, what can be done about it? Can it be fixed?
Very common because COVID-19 is not only a respiratory illness, but it's a vascular illness. It affects actually the circulation of the brain and the heart. So,
Dr. George Diaz says about 1 in 3 COVID patients report neurological and psychological symptoms from the virus. He treats them long after their infection at the new post-COVID clinic at Memorial Healthcare in South Florida. Dr. Diaz says brain fog and cognitive decline are common symptoms in COVID long haulers. So the Oxford study isn't surprising, but one big question remains.
Is it that way forever, or is there hope for them that they can do something to get back to where they were before COVID?
Well, that's $1 million question. And I don't think we know. The bottom line is that we don't know the answer to that. And I think it's going to be some time until we do.
Doctors tell me that they hope young and healthy people who are still on the fence about getting the COVID vaccine will understand and appreciate the risk for this brain damage should they contract the virus. Reporting live in West Palm Beach, Danielle DeRoss, CBS 12 News.